The definition of pain from the International Association for the Study of Pain is as follows. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. While there are many types of pain, it is the intent of this video to discuss chronic pain. In an article in 2018, the Center for Disease Control estimated that 50 million Americans suffer from chronic pain. I will begin with what chronic pain is and how it differs from acute pain. Once chronic pain is documented, I will examine how lifestyle medicine can be used to manage it. First, addressing what to avoid, such as tobacco, alcohol, and opioids. Then I will move on how to actually manage chronic pain using the other core competencies of lifestyle medicine: exercise, stress management, relationships, sleep, and nutrition. By the time you have watched this video, it is my intent that you will understand how to manage chronic pain with lifestyle medicine. Pain can be described in many ways: stabbing, shooting, burning, persistent, aching, throbbing, dull, or sharp. And if you were told it was all in your head, you might be offended. But according to thebrainimmune.com, chronic pain is an evolving concept, and much of what you feel is based on a mental preconception. That is not to say that you are imagining it, it's just that it's complicated and not currently well understood. They state that even with many treatments available, we still cannot appropriately manage chronic pain. The chronic pain information page at the National Institutes of Neurological Disorders and Strokes explains that acute pain is your body's warning system to let you know of possible injury or the need to take care of that injury. Chronic pain, on the other hand, persists long after the danger is gone or the injury is healed. What is chronic pain syndrome? At WebMD explains that 25% of people who suffer from chronic pain can go on to develop chronic pain syndrome. Well, there are many causes of chronic pain: arthritis, back pain, headaches, and fibromyalgia, to name just a few. It is beyond the scope of this discussion to go into detail on all of them. I believe it's fair enough to say that many people deal with chronic pain and its suffering on a daily basis. The point of this video is to help you learn how to manage chronic pain with lifestyle medicine, no matter where it comes from or what it's called. It is the intent to empower you to manage your chronic pain. While your first instinct might be to control your pain with prescription drugs, tobacco, or alcohol, here are a few things to consider. In a clinical review, Pain Management with Opioids, the Journal of the American Medical Association found that while 40% of United States adults have been prescribed opioids in 2015, and that there were 47,600 deaths that were attributed to opioid involvement, their use in chronic pain is not evidence-based. In fact, in a meta-analysis of 96 randomized controlled studies of more than 96,000 patients, they found the benefit of opioids to control pain reduced after a few weeks. So while there are many times when opioids are called for, like after surgery or for acute pain, it is the intent to help you manage your pain without the needs of opioids. Another common way to deal with chronic pain is alcohol. From the National Institute on Alcohol Abuse and Alcoholism, we learn that while alcohol has been used since ancient times and that 28% of people who experience chronic pain use alcohol to dull their pain, they may be doing more harm than good. There are many problems with alcohol. Alcohol and acetaminophen can lead to liver failure. Mixed with aspirin, it can cause gastric bleeding. Combined with opioids, it raises the risk of overdose. And perhaps more cruelly, chronic alcohol use leads to increased pain sensitivity, and prolonged use can cause peripheral neuropathy, yet another chronic pain problem. You might be thinking, tobacco. Another lifestyle choice to be avoided for many reasons is the use of tobacco. Why smoking will worsen your chronic pain from the Cleveland Clinic. It explains that while nicotine tricks your body into releasing dopamine, known as the feel-good chemical, it also impairs the blood flow to bones and tissues. It's linked with slower healing times, and there are many other risk factors for not smoking beyond the scope of this video. Suffice to say, smoking is definitely not going to work long term. It may work short term. Enough about lifestyle behaviors to avoid. Let me move on to how lifestyle medicine can help you manage chronic pain. In his book, A Pain Doctor's Guide to Relief Confronting Chronic Pain, Stephen Reichmer, MD, explains that the benefits of exercise to alleviate chronic pain include decreased pain, increased energy levels, improved mood, enhanced joint health, better quality of life, and controlling your weight. He does give the following recommendations to follow. Talk to your doctor before you begin. Start slowly. Move at your own pace. Try to be consistent, accept that some days will be better than others, and be careful not to overstrain. For years, the standard prescription for pain was inactivity and rest. In Physical Activity Exercise for Chronic Pain in Adults, an overview by Cochrane Reviews, they found that out of 381 studies, including 37,143 participants, when comparing exercise to non-exercise, the following results. There were few adverse effects to exercise. In fact, including it in your daily routine, physical activity could improve the severity of pain, improve physical function, and lead to a better quality of life. The American Academy of Pain Medicine recommends trying a combination of stretching, strengthening, and cardio to relieve your pain. They point out that walking and swimming are good to start with. There are other types of exercise such as yoga, qigong, tai chi that many find bring relief, but I am choosing to include those along with my stress management techniques. In Chronic Pain and Chronic Stress, two sides of the same coin, the authors argue that pain and stress share physiological overlaps and that they are both upset homeostasis, and they share a behavioral model that fails to rid itself of negative memories. In short, both pain and stress are learned by the body and sometimes held on to, much to the detriment of the body. Both stress and chronic pain decrease the quality of life. Stress exasperating pain and pain causing stress. So it would be prudent to help modulate your chronic pain by managing your stress. WebMD offers the following tips to help alleviate chronic pain by managing your stress. Deep breathing, meditation, mental imagery, listening to music, biofeedback, massage, or simply distracting yourself with something you enjoy to take your mind off the pain, if only for a little while. One type of breathing exercise that I really enjoy is the relaxation response by Dr. Herbert Benson. He has a book by the same name, but you can find his YouTube video to learn this technique. The Common Health of Virginia offers relaxation techniques for stress relief. In addition to the tips already offered by WebMD, they suggest yoga or Tai Chi. Yoga is a series of poses that combine breathing and movement as well as stationary poses. They stress that when practiced regularly, it can strengthen the relaxation response. And in addition, you will receive the benefits of flexibility and balance. The definition of Tai Chi from the Merriam-Webster Dictionary is an ancient Chinese discipline of meditative movements practiced as a system of exercises. In addition to these stress management techniques, I would add having a cup of tea or taking a bath, or maybe both at the same time, children, family, and friends. I think the main takeaway here is that you have to be honest with yourself and those close to you. Communicate with those close to you. Be reasonable about your expectations of what you are capable of doing and learn to ask for help. Another important tip is to try and not cancel plans with people. Isolation can only make it harder to deal with chronic pain. Sometimes it is important to find support outside your circle of relationships. The American Chronic Pain Association explains that support groups offer validation and education and life skills. That many support groups are ran by members and they understand what you are going through. They point out that these groups don't necessarily focus on symptoms or treatment, but rather on supporting, encouraging you to create a better life and to help you manage your chronic pain. They also offer information on finding a group near you or help with starting one of your own. The National Sleep Foundation reminds us that those who suffer from chronic pain are more likely to suffer from sleep loss. They say pain is related to two other health conditions, stress and poor health. In fact, 65% of people with no chronic pain report a good night's sleep, while only 37% of those with chronic pain can say the same. People with chronic pain feel less control over their sleep and report that lack of sleep interferes with all aspects of their life. However, the problem is made better by those who make sleep a priority. Since sleep is an indicator of overall health, those with chronic pain must make an effort to ensure that they get adequate and restful sleep. They need to pay attention to environmental factors, such as light, temperature, and even their mattress and pillow, taking care to make sure that their bedroom is conducive to sleep. People with pain also feel less control over their sleep, worry more about lack of sleep, affecting their health, and exhibiting greater sleep sensitivity. They're more likely than others to say environmental factors make it more difficult for them to get a good night's sleep. They need to make sleep a priority. The same sleep hygiene tips that work for most people should be considered for those with chronic pain. Limit caffeine, alcohol intake, use of painkillers or sleeping pills unless under the direct supervision of a physician. Practice relaxation techniques or try listening to one of the meditations, especially one that deals specifically with pain. It must be said, though, that sometimes if you're not having luck with any of these or you think you suffer from sleep apnea, it's time to seek a medical practitioner. Maybe I saved nutrition and diet until last because I imagined it would be the easiest. After all, my degree is in nutrition and dietetics. However, I find this is not to be true. While there's a plethora of dietary advice surrounding chronic pain and inflammation, it seems to be conflicting. Even the medical studies, a lot of them done on rats, seems to come up with results that cannot be replicated by their peers. I would say, in general, a few things that they all agree on. One, including more fruits and vegetables in your diet is a good thing, and excluding processed foods and sugar is equally beneficial. I have to say, after looking at many resources, both medical and lay, the only diet I feel comfortable in recommending to deal with chronic pain is the same one that the American College of Lifestyle Medicine recommends for general health, the Whole Foods plant-based diet. They recommend eating a wide variety of fiber-filled, nutrition-dense foods from a rainbow of fruits and vegetables, beans and grains. Michael Pollan, author, actor, journalist, and professor at Harvard and Berkeley, sums it up this way: eat food, not too much, mostly plants. His 7 rules for good eating can be found at WebMD. To finish off this video, I can say that the core competencies of lifestyle medicine, avoiding substances that harm, exercise, stress management, relationships, sleep, and nutrition are the same things that should be done to help manage chronic pain. I'm going to keep this short because I hope I already made my case. And if you are hoping to manage chronic pain and improve the quality of your life, I think following these practices will be very helpful for you.